Okay, so we're going to do a neck adjustment or cervical adjustment. What I'm going to do is look for restriction of movement on the joints of the neck with my hands and then adjust, okay? I'm going to do a normal adjustment first, then I'm going to use a Y adjustment, Y axis adjustment. So I always palpate the joints to look for restriction of movement. I'm going to go here on the right side. So this is good for people with neck pain, headaches, shoulder tension, shoulder pain. You have numbness and tingling on the hands as well. Okay, now with a towel, I'm going to use a Y traction on the neck. Don't try this at home. Okay? Put this right here. Okay? So I'm going to do a little bit of traction to decompress the spine. Choking you? No. So sometimes when you do that, you feel it on the whole spine, sometimes just on the neck where you have most of the compression. Nice.
Up. Go a little lower.
Cross the arms. Okay, now we're doing flexion distraction to decompress the spine, stretch the spine here. Bring fluid to the disc, open up the space of the disc and the nerve. Okay? When I push here on the neck, there's a neck decompression as well. When I move him to the sides, it's good to work with the curves of the spine. Then if you have some scoliosis or if you have some tilting or bending to the side.
Well, you know where your thumb is?
Yep.
Oh, that part, that part of it. Yeah,
Right there?
where your thumb is. Just slightly up. Up. Oh, right there.
Sometimes use this to relax the muscles, work on the trigger points as well, on the nuts on the muscle.